I'm Oya Gilbert. I have multiple myeloma, diagnosed in 2017, the day after Christmas. And this is my wonderful future fiance.
Carrie Hellman, caretaker extraordinaire.
How important would you say it is to be your own health advocate?
I can't even.
More than anything, literally more
It's
than
priceless.
anything.
You have
can't
to.
not. And it doesn't even matter if it's cancer. Like, I don't know if it's the culture that we're in, post-COVID. I don't know, everybody goes to the doctors, everything's so busy. I don't know what happened. Or maybe it's always been like that, but we haven't been exposed to the medical profession as much as having to be with cancer. But I feel like there's a serious lack of personal attention. I understand that everybody can't come into their appointment with their patients and talk about their dogs and their kids and their parents and their vacations, and I get that. But the fact that every time you go into an appointment, you have to repeat everything 3 and 4 times to 3 and 4 people that's all kept in the same system is a colossal waste of time. It shows that nobody's actually paying attention to the patient and really getting to know that patient. It takes 5 minutes to review his chart before you come in and sit down with them, and you made him wait 2 hours to get here. Like, that's just absolutely deflating for someone facing a life-threatening illness or a bad flu. It doesn't matter. We need health care. We need legitimate care, not just...
It almost becomes like an assembly line.
It really does. It really does.
It feels like that way at times, where they're just chugging them along. And we had I had an interesting conversation with a doctor at some point, and didn't realize that they have KPIs too. They got, the hospital has
see so many patients in an hour.
And that's just like, that's the reality of it. But that's crazy. Especially, you're right. It doesn't matter what thing, but especially with some kind of cancer that could, take your life. I'm not saying it's been 4 hours with me, but just, you gotta humanize this thing. People that's coming into these appointments, all this data and data and data and data, and there's a person behind that. There's a person that has feelings, that's nervous, that's this, and they should have the ability to see that, or at least factor that into their care. It certainly would have done wonders for me, and I think most people would have said the same thing.